Well, good afternoon, and thanks for joining our webinar today. I'm Dr. Elliot Dennis, Assistant Professor in the Department of Agricultural Economics, also associated with the Center for Agricultural Profitability here at the University of Nebraska-Lincoln. And today is part of our center's weekly webinar series, which usually happens Thursday at noon Central Time. Full schedule is available at our website at cap.unl.edu, and that has previous recordings as well as upcoming webinar events that we'll be having, generally scheduled about 4 weeks to 6 weeks out. Today is kind of a really relevant topic and one that we really felt like we should put together. And we're going to be discussing the various implications of this ongoing wave of the high pathogenic avian influenza, sometimes referred to as HPATH. And specifically, we're going to look at where things stand with infections, what this means for markets, economic impacts, poultry health, and overall biosecurity. Because this isn't the first time we've had high path in the United States, we'll be really looking at past lessons from the earlier and the most recent 2015 session where we had an outbreak, and also address some of the protection impacts for backyard flocks. We have a great panel today. And really grateful for the 3 experts that have joined us. These are people who are involved in the poultry industry and have published work on the high path avian influenza. We have Dr. Matthew MacLachlan, and he's a research economist with USDA's Economic Research Service based out of Washington, D.C. We also have Dr. Reynolds, or Don Reynolds here. He's a professor in poultry veterinary extension specialist here at UNL. And we also have Shelia Purdum, a professor of poultry nutrition here at UNL. So hello to everyone, and thanks for joining us today, and welcome to all the participants. We'll have time for Q&A about 15 to 20 minutes at the end. So I'd really encourage you as you're listening, please provide some questions either in the Q&A box at the bottom of your screen or the chat box, and we'll get to those at the end. And so I'd like to turn it over to Dr. MacLachlan, and if you can share your screen, and look forward to hearing from you.
Thank you, Elliot. So hopefully y'all can see my screen now. I can't see you, so interrupt me if there's any issues, please.
I think we can't see it yet.
Can you see it or no? Oh.
Nope.
All right. All right, I think that's better. And then let's go to view mode. Is that working all right now?
Looks great. Yep.
Thank you very much. All right, so what I'm going to present on today is lessons learned from 2 of the highly economically impactful recent outbreaks of highly pathogenic avian influenza. There were 2 additional outbreaks in 2016 and 2017 that we will not address here. They had much more mild impacts. So we'll really focus in on the 2 that impacted exports and production. So with that, we'll first talk about the 2004 outbreak, which was relatively small in scale. It was limited to a single facility where 7,000 birds died from the disease or were called to control it. And while there were very limited production losses from this outbreak, 44 importers of US poultry meat placed embargoes on imports from the United States, which led to very large export declines of US poultry meat. However, price impacts were not detected. We looked back both at the series and did some estimation, both visual inspection and then also some estimation, and we're just not able to detect a price impact. This is likely because of one of 2 explanations offered elsewhere in the literature. Thompson in 2018 found that the preference for fresh meat has really grown over time. Back in 2004, the premiums was not as large. An alternative explanation is there were other HPAIs that were concurrent with the US outbreak in 2004. In contrast, the 2014-2015 outbreak was very large. It represented the largest animal disease outbreak in US history in terms of animals lost. About 50 million poultry birds were lost between 2014 and 2015. The current outbreak, while it's not over, about 33 million birds have been lost as of this morning. So I first started working at the economic research in 2015. My first job was to look at the 2014-2015 outbreak with two of our outlook specialists who focus on poultry markets and to determine what the economic impacts of this disease were. We found that there were limited infections of chicken meat or broiler chickens, while there were high losses of both turkeys and egg layers, representing about 8 and 12% of the domestic flock respectively. However, broiler producers were not entirely spared from the epidemic. Revenues decreased fairly markedly for this group. If you just look at year-over-year revenue changes between 2014 and 2015, this suggests about a $4 billion decline in revenues between the 2 years. This may have been a little bit larger than the actual losses because revenues in 2014 happened to be very high within a historical context. At the same time, there were about $880 million in control costs and indemnity payments that were spent by APHIS. So in this initial report, we found we did a cursory examination of all of these impacts, but we're not really able to take a very deep dive in order to provide a timely report on the issue of impacts on broiler chicken. So in a recent research article that I wrote with two co-authors, we evaluated the impacts of embargoes on broiler chickens alone. All right, and so the 2014-2015 outbreak looks very much like, or a lot more like, the current outbreak, so we will explore a few features of this outbreak. First, the disease proceeded down the Pacific Flyway first between December and March of 2015. The first case was detected in a backyard poultry flock in Washington, and then the disease progressed southward towards California. The much more impactful outbreak, or part of the outbreak, was down the Mississippi Flyway, where wild waterfowl transmitted the disease to primarily to both egg layers and turkeys. Losses were concentrated in this Mississippi Flyway and were really concentrated around Iowa and Minnesota. And here we just have the number of birds lost, not necessarily economic value. Now, this outbreak largely occurred away from broiler producers. Broiler production is concentrated in the South and Southeast, with a little bit more in California and the West Coast. So while the disease was present in areas where egg and turkey production is fairly intensive, it just didn't happen to be as close to the broiler producers. By and large, there were some exceptions in places like Missouri and Arkansas. But in total, a fraction of a percent of the whole broiler flock was lost. This supported some regionalized trade restrictions or placing embargoes in states or regions with HPAI while not placing embargoes away from the disease outbreak. All right, here are a few indices for production and prices across the three categories of poultry birds. We have broilers in yellow, turkeys in blue, and egg layers in red, or eggs in red. And we've developed an index that's set to 100 at November 2014, right before the outbreak started. The gray shaded area is where the outbreak was ongoing. And we see that production losses were heavily concentrated towards the end of the outbreak and in turkey and eggs, while broiler production actually increased around the outbreak and then following it. In following expectations, we have decreased production. These products became more scarce, so prices for both eggs and turkeys increased near the end of the outbreak and immediately following. In contrast, broiler meat prices simply went down and then stayed low. Exports for all three groups decreased. When production declines, you expect exports to decrease also, so it's not surprising for turkeys and eggs that exports decreased. And then broiler exports decreased, although there wasn't a decrease in production. We lost access to international markets from embargoes. All right, so setting up just a very quick economic model to bring all these ideas together. We have domestic consumers and non-risk averse international consumers of US poultry products. We're specifically thinking about broiler meat here. We have a group of risk averse consumers, and they're going to come together to make an aggregate demand or have an aggregate demand. And we can roughly approximate this with this blue curve on the right. In a well-functioning market, this will intersect with our supply function, which we have drawn near vertical because it's very difficult to adjust broiler meat output, at least in the short term. And in a well-functioning market, when HPAI isn't present, we simply look for the intersection of these two curves to find a normal price and quantity. However, when we have HPAI, embargoes are placed and we lose this second group of consumers. Effectively, our demand for meat decreases or shifts inwards, and we have a new price and a new quantity, which we expect to be lower. So this is where the economic losses are going to come from for producers. Here we have a long time series. If this is a bit tough to follow, it's not that surprising. What we see for broiler markets during the HPA outbreak is fairly mild changes versus what we might expect to see. So exports, prices, storage, and production do not leave their historical ranges during the outbreaks. We can see decreases in exports and prices, but again, these are well within the historical range. And these decreases do not occur in a single period. So what we don't see is a dramatic shift that we might expect during one of these outbreaks. So the timing of these impacts is a little bit hard to determine. We have a couple of candidates for when this could happen. So first, we could think about embargoes just being placed when the first case of HPAI is observed and confirmed, which in 2015 happened on January 9th. At that time, importers can choose to impose embargoes, either nationally or at the regional level. They can do nothing, meaning not alter their trade policy. And then the third option is to wait and see. The disease progressed. The disease spread in 2015 and very much increased in March, April, and May of that year. So the importers can change their decision at any point along that epidemiological curve. And then OIE, or the International Organization for Animal Health, suggests keeping those embargoes imposed for 4 months following the disease outbreak, or the last confirmed case. Bringing all that information together here into a nice visual. The blue line shows the cumulative number of birds lost over time, and the red shaded area shows when the disease is present. OIE guidelines roughly suggest to impose embargoes for about 4 months following the last confirmed case of HPAI. However, they do not provide as concrete guidance when the disease is present in wild waterfowl or other wild birds. It's very hard to confirm or say the disease isn't present when it's in those wild populations. All right, and so what did we find when we went through our estimation approach? In 2004, we saw very large export decreases at the monthly level, but for a very short period of time. So for about 4 months, we saw approximately 20 to 25% decreases in exports with a very limited price effect. In contrast, in 2015, we saw both export decreases and price decreases. If we estimate this for a longer window, these decreases on a monthly level are more mild. If we estimate just towards the end of the outbreak, we see much more pronounced export and price decreases. Why does this matter? Lower prices reduce producer surplus. And so what we estimated is that the welfare losses to producers from these price decreases were somewhere between about 340 and 570 million. So it's relatively close to the estimates APHIS put out at about 280 million, and much different than just comparing year-over-year revenue differences, which would suggest a loss of about $4 billion. All right, and so what were some of the lessons that we could pull out of this? We saw that storage increased in response to the first outbreak, whereas prices decreased. This is likely driven by consumer preferences. Consumers have increased the premium that they place on fresh, not frozen meat between 2004 and 2015. This will likely be the case for the ongoing outbreak as well, that we're looking at goods that function more like perishables and not storable goods. A couple of conclusions. In 2015, we saw that egg and turkey production decreased and prices increases, fell directly in line with what we would expect. For broilers, the story is much more nuanced. We see that exports decline and prices decreased in 2015. We see very little evidence of production changes, meaning that at least in aggregate, this isn't necessarily true for every single producer, at least in aggregate, there isn't a strong response in the short run to HPAI. And again, market responses were more pronounced late in the 2014-2015 outbreak, which suggests that markets are sensitive not only to the presence of HPAI, but the spread and intensity of the outbreak as well. And I think I've gone over my time, so I'll say thank you and pass it along.
Yeah, thanks, Matt. And once again, as a reminder, if you have questions for Matt on some of the historical stuff about lessons learned from the 2004 or the 2015 high path outbreak and what that potentially means for the economic impacts, please put those in the comments and we'll get to those. Next, joining us, we'll have Dr. Don Reynolds, and really appreciate it. And he's going to give us kind of a current update on what this all means for the US and particularly here in Nebraska. So pass it over to you, Don.
Thank you, Dr. Dennis. I'm assuming you can see the screen. The first slide says Avian Influenza USA and Nebraska update.
Yep, we can see it.
Okay, very good. This is an updated slide I took yesterday from the USDA website, and things are changing very rapidly here. This does not include the outbreak that was declared yesterday here in Nebraska. So if you look at this, we have 158 commercial flocks. We know now it's 159. There's at least 85 backyard flocks, and there's 33.38 million. Now, that does not include the 2.3 million that laying chickens here in Nebraska. So we're up to over 35 million currently in this outbreak. Now, I want to contrast this just a bit to the 2015 outbreak. In 2015, there were 211 commercial flock detections, and there were 21 backyard flock detections. So you can see we're over 4 times as many backyard flocks as we are commercial flocks. So we're putting an impetus on trying to get the word out to backyard flock owners to about avian influenza and how they can protect that, and I'll talk about that in a minute. The 22 AI detections by the numbers of birds, and you can see Iowa sticks out there. That's because there's been more laying chickens, and when you have a laying chicken operation, you're talking about millions of birds as opposed to broiler chickens or turkeys that would be in the tens of thousands. Now here's a relatively updated, this was as of yesterday and does not include the recent Nebraska outbreak. But you can see here where most of the detections are. Now this is in commercial birds, and you can see up in this Midwest, North Central area. Now the yellow are broiler detections, and there are very few broilers. The green are the layers, so there are fewer layers, but as I mentioned earlier, the numbers are tremendous. There's just only 2 black, and these black are commercial game birds. So there are not a lot of birds there, but there are some. But everything else in here, all these purple, green, orange, whatever, are turkeys. And so the turkey industry, especially up here in Minnesota, South Dakota, has been hit very, very hard. And people say, well, why is this? Is their biosecurity not as good, et cetera? Well, perhaps, but we also know that turkeys are more susceptible to this virus than. Here's the wild birds. Again, this is from the USDA website, and these are detections in wild birds. And I want to point out this East Coast. Look how many wild bird detections there are, as opposed to the North Central area. And as Dr. MacLachlan said, in 2015, the outbreak started in the Pacific Flyway. That's not the case today in this outbreak. This started down the Atlantic Flyway. So some people say, well, where did this come from? Well, the epidemiologists, molecular biologists have traced this, and it started in an area we call Eurasia. So that's the eastern northern part of Europe and the western northern part of Asia in wild birds. And then in 2015, this spread, if you looked at the Earth from the North Pole, it spread westward and through Siberia, crossed over through the Aleutian Islands, et cetera, and came down the Pacific Flyway. But this one actually originated and went eastward, went into Europe, areas of Africa, Northern Africa. And then it appears now there's data to say that it actually went into Iceland. And our first detections here in North America came from Newfoundland. And from Newfoundland, then in Nova Scotia and the Atlantic provinces, and as you can see, came down the Atlantic coast here of the U.S. in wild birds, and then spread from there. And then once it hit the central area, especially in turkeys, it really took off, so to speak. Here's the most current detections in Nebraska. And you can see the yellow or backyard flocks and the blue or commercial flocks. The one up here in the most northern blue is the one that was just detected earlier this week. There's 2.3 million laying chickens involved. The one just east of that, again, laying chickens, that's 1.7 million. So we have about 4 million birds right there. The one down here in the eastern central, those were broiler chickens. 2 farms there, almost 1 million. So we have, commercially, we have 5 million birds that's been infected and will be depopulated here in Nebraska. Now this is a very interesting epidemiology map. This happens to be weeks here on the x-axis. And you can see this starts out here in December of 2014, and it just kind of perked along. Now the red are wild birds, the blue are backyard flocks, and the green are commercial. So it just kind of perked along here, not much going on until we got to the end of March and the 1st of April, and then it just exploded. And you can see here the peak where it says 38, that's actually the week ending April 28th. So we're right in the middle of it here, and it starts to decline, and it's pretty much over by the end of June. It looks as though it's repeating the same situation now. So, and we'll talk about why this springtime is so important. I want to talk just a little bit about avian influenza and the basics. So here we go. Springtime is a bad time of the year for avian influenza because we have a lot of freezing and thawing and a lot of water. Typically we get more rain, so there's a lot of puddles, etc. And there's a lot of migratory fowl. Now, this is just perfect conditions for the survival of the virus. The virus is an influenza virus. It's what we call a single-stranded RNA membrane virus. It doesn't survive very well in heat or dry weather. So this moist, cool area now, or time of the year now, along with the migratory waterfowl, really promotes the survival and the transmission. Now, we have to remember in the waterfowl, these birds can be infected but not have clinical signs. So they become the carriers. And they not only expel or spread the virus in their nasal secretions, eyes, etc., but also from their intestinal tract. So when they defecate, there's live virus there. So birds can be swimming in a pond, a puddle, stream, whatever, or defecate along the banks around the puddle. And as we know, many geese, etc., like to feed in fields. Someone walks through there, perhaps another animal, another bird, etc., and they can spread the disease. Now, commercial flocks have good biosecurity, although I think what we're going to be seeing after this outbreak is even though we have good biosecurity, that's not containing or curtailing these outbreaks. So there's another subject about vaccination we can broach, but we'll put that on hold for right now. But small backyard flocks we think are a major concern. Why? Because frequently these birds are housed in open areas outside. I just had a case here that somebody called. They had high mortality in their flock. There were a few birds in the backyard running around. It shared a pond with ducks they had and also waterfowl, etc. So there's a lot of access to ponds, puddles, streams. There's also a lot of access to wild birds, especially waterfowl. Oftentimes these backyard flock owners, and not all, but oftentimes they're not as astute at monitoring the birds. In a commercial operation, they know exactly how much feed is consumed, how much water is consumed. They monitor the behavior of those birds to see if they're depressed, etc. That's not always the case in the backyard flocks. As a matter of fact, this case I had just recently in a backyard flock, that was one of their concerns. All of a sudden, my bird just started dying. Avian influenza occurs in two types. We call it the H5 and H7. There are other types as well, swine influenzas, H1, etc. But the high path is the H5 and H7, and they cause sudden onset of mortality. But we also have low path, and low path may not cause clinical disease, and it's often found in waterfowl and other birds. And the important point here is that low path can convert or mutate into high path. So we have this kind of perfect scenario where birds, especially wild birds, can fly around the country or the continents, etc., spread this disease, and it may be in a low path form and then mutate into a high path form. Here are the clinical signs. I took this right off the USDA website. We want to make sure that we have consistency here. So one of the most common signs we see is all of a sudden the birds just die without any reason. Also lack of energy, appetite, decreased egg production or soft-shelled eggs or misshapen eggs, swelling of the head, comb, eyelids, wattles, and hocks. This is primarily in chickens. What we see in turkeys is that nothing happens much, but they become infected, they become shedding, and just shortly before they die, they become lethargic and they just die. Sometimes we have nasal discharge, coughing, sneezing, incoordination, and diarrhea. Unfortunately, there are other diseases that cause the same or similar clinical signs. So these are not what we call pathodemonic. These are not specific to avian influenza. So we do need to test these birds, and we need to make sure they do have or do not have high path avian influenza. What do you think your birds have avian influenza? Well, get a hold of someone. You can call your local veterinarian if you use one. You can call the state veterinarian's office in Nebraska. It's Dr. Dudley. You can call the USDA. They have hotlines. And then last resort, you can always call me. We'll get you the help. don't be afraid to call people. We would be most happy if you called, we came out and tested and they were negative. But we certainly do need surveillance in any way we can. So let's say you call, you test, what happens? So the authorities, quote, the authorities will come out and they will take samples from the birds. They will take tracheal swabs if they're dead birds. They'll take oropharyngeal swabs. And what that means is that they will swab the opening of the trachea, the pharynx, and then the choanal cleft. That's the kind of the cleft palate of the bird. They'll also take cloacal swab. That's the other end of the bird, the vent of the bird. They will take those swabs, they'll bring them to our lab here to Nebraska Veterinary Diagnostic Center or another state laboratory. And we will do those samples that day within hours. If they're negative, that's reported to the owner and nothing more happens. They can kind of work with their veterinarian to figure out what's going on. If they're positive, then the federal and the state veterinarians are informed and they kind of take over the process. Those samples are immediately sent to the National Veterinary Services Laboratory in Ames, Iowa for confirmation. We actually report out that they are either negative or they're non-negative. We don't say they're positive. We leave that for the federal authorities and at the NVSL. The premise will be quarantined. If it is positive, the birds will be humanely euthanized, depopulated, disposed of in a biosecure way, and the premise will be cleaned up. Indemnity payments will be made to the owners. And because there is a potential of a zoonotic disease, that is, people can become infected, the public health departments are notified and people are kind of followed. Now, there's a low probability of people being infected. The CDC has issued a kind of a statement on this that it's not a public health threat. It's if people do get infected, it's usually a mild respiratory case and it's not very transmissible to other people. Eggs and poultry products are not transmitters of disease to people. Okay, they can be transmitters of disease to other poultry. And so when we have a laying facility, for instance, that's deemed positive, those eggs are also quarantined as well. The virus is not contained within the egg, but it can be contained on the surface of the egg and be transmitted that way. How you protect your birds? Well, and this is, I think the commercial people know about all this, but this is about small backyard operations. Limit the exposure of birds to the outside, especially to water, ponds, puddles, etc. Beware of wild birds using your feeders and waters. Oftentimes, even if they're caged, they'll fly through the cage, get a free meal, be able to transmit the disease. Limit any visitors, especially those that have poultry. Limit any exposure to other birds. And there has been a moratorium now on poultry events here in Nebraska, at least till May 1st. And now with this new outbreak, perhaps that'll be extended. I don't know. Quarantine any newly acquired birds. And I say at least 2 weeks at the very minimum. And properly clean, disinfect waters, coops, feeders, etc. More on the biosecurity. I have this website, Big Red Biosecurity. You can just Google that, or there's Defend the Flock, which is a USDA website. We'll leave it there and pass it on to Dr. Purdum. Thank you.
Yeah, thank you, Dr. Reynolds. Appreciate you sharing that update and also kind of some of the signs and symptoms of that. Very informative. Once again, if you have questions for Dr. Reynolds about anything he talked about, please put those questions in the Q&A box and we'll get those at the end of the webinar. Next, we have Dr. Purdum, and she's going to share with us a little bit about backyard flocks and also some nutrition. And welcome to the webinar, Dr. Purdum. Oh, I think you're muted still.
All right.
There we go.
Okay, do you have I'm getting my presentation up. Okay, so I just want to follow up a little bit on what Dr. Reynolds talked about. And obviously this is a little bit, this is a week-old graph. It's everywhere, folks. It's everywhere where you may travel. It's everywhere where you may vacation. And it's it's a big problem. And obviously it's affecting egg prices. I don't think, Matthew, you showed this graph, but when you take away, 33 million, which is probably about 8 to 9% of our flock, egg prices are going up. But just for your information, egg prices aren't just going up because of a lack of supply right now. Egg prices are also going up because feed costs are higher. Okay, and feed costs are higher, probably based on another whole webinar you're doing, Elliot. There's many things. So I don't want you to think about feed costs, egg prices going up just due to AI. It's a complex economic equation that brings in other factors as well. And exports of eggs are not as big of a part of the industry as exports of broiler meat. Okay, so that's not quite as big of a factor here. The biggest problem is your housing situation for your birds. Many backyard birds look just like the picture on the left. They're out in your backyard, they're not contained, and they really aren't totally separated, let's say, from a migrating songbird or migrating waterfowl if there's water nearby. Whereas a commercial unit, the birds are contained in houses, and typically those houses are pretty tightly closed, such that songbirds or debris from migrating birds shouldn't get into that house. So how do we protect our birds when they're in the backyard? What I tell my friends is if you have a coop, similar, let's say, to something you get at Tractor Supply, close those birds up in that coop, okay? You may think it's tragic that the backyard producer can't let them roam around freely, but you're protecting the birds. So enclose them actually in the coop with a cover and protect them from any waterfowl interference. You do not want songbirds eating or drinking from the same feeders that you're feeding your backyard birds. And you're not hurting them, okay? They can survive, as we know, quite well in a closed up facility. I have birds at home. They're actually in a dog kennel, and they are in a covered dog kennel, and they're not allowed out right now. And so I'm doing that until the veterinarians and the epidemiologists say it's okay, you can let them out now. And what I tell my friends, okay, and I think Dr. Reynolds and I have talked about this, is you need consistent hot temperatures. We need to have no outbreaks for a couple of weeks. And those are two of the major things, all right? But again, when you leave them out, they shouldn't be going down to the pond and cohabitating with the migrating fowl. And migrating fowl is a big issue right now. I live near Bennett, Nebraska on an acreage, and I see more migratory fowl hanging out here in Lancaster County over my neighbor's farm pond and another neighbor's and flying around than I've ever seen. They're closer and closer in. And I don't know if that's due to the drought and they're staying longer in open water areas, or what's going on, but that's a natural resource question that we all have. Chick purchases. Fortunately, you can still purchase chicks from an MPIP approved hatchery. And those chicks are available at Tractor Supply, Orscheln's, mail orders. That has not been stopped. Those who have an interest in raising poultry can still do so. But do not, obviously auctions and swaps has been shut off. The state Nebraska Department of Ag has limited and restricted those types of opportunities to get chicks. But I was at Tractor Supply yesterday and the chicks are there. So you may go get chicks. But when you work with your chicks, be sure to wear different boots, okay? Don't go to Holmes Lake and enjoy a picnic and walk through goose poop and then take that goose poop back into your backyard facility. And the goose poop is everywhere. I have seen goose poop in front of St. Elizabeth's Hospital here in Lincoln. So be conscientious of where you are and what you're walking through and what you're exposing your physical person to. And then when I go home and I go to do chores, because even here on campus, there's geese. They're right out there on the grassy lots to the north of campus. I have farm boots. Those farm boots don't come in the house and they don't go to work. Again, don't visit parks or areas with large numbers of migrating waterfowl unless you plan to completely clean up and disinfect, sanitize. Wear barn clothes, jackets, and barn shoes only in the barn. And if visitors come, your cousins come and they want to see the baby chicks, you know, it's hard to resist, especially at Easter time. But again, they're going to have to make sure that they're not wearing the same clothing and boots that you just went and did your Easter egg hunt in down by the pond. All right. So these are practices we're not used to taking on the small flocks. We know about these practices from commercial units, but it's hard. It's hard to adjust our behaviors to protect the birds. It's hard to not enjoy watching them forage in the barnyard. But those are just things that we have to conscientiously do until we go from basically what I would call red light right now to yellow light to green light. And when the green light comes on and Dr. Reynolds and we can say, okay, it's green light, it's safe now to let them out, but still follow these precautions. You're just going to have to keep them contained. And this is happening not just in the United States, but in Europe and other countries as well. So I'm going to wrap up there so we can enjoy the question and answer period.
Yeah, thank you, Dr. Purdum. Appreciate that. And once again, if you have questions for Dr. Purdum, specifically about maybe background or backyard flocks, I think she would be able, or just nutrition in general, I think she'll be able to answer those for us. Okay, so why don't we start with, we've had several questions come in already. Matt, if you want to take this one, it says, do you think COVID experiences may influence the preference of consumers to being more open to frozen versus fresh poultry and thus not impact price as much at this time? Maybe you could just talk about some of your work of, you know, at looking at food prices that that you're currently working on.
Yeah, so I transitioned about a year or two ago from looking at infectious diseases to looking at retail food prices primarily. And preferences certainly have shifted a fair amount since the onset of COVID. We've seen a rapid and marked decline in consumption of food away from home, which is important for some of these meat products. At the same time, we have seen changes within the composition as well for food consumed at home. I would have trouble answering this specific question. I went to the BLS data when I saw this question just to make sure. They track expenditures and weight by expenditures over time. They do break out fresh versus frozen chicken, but they unfortunately don't share the expenditure data for that. It's very difficult without the right data resources to answer that. We will probably be able to, at ERS, answer that in the near future as we're getting more data on purchase patterns that's coming in and being cleaned up right now. Very, very important question. And I think that's one that we'll have to take a very serious look at in our group.
Yeah, and I think that was kind of coming from, you know, in your presentation, you had said that from the 2015, the difference between the 2004 and the 2015 was really that shift towards kind of fresh poultry products. So yeah, so thanks. We'll look forward to that. I have a couple questions for you, Don. When do you think this high risk will end this spring? I thought maybe we are past migration time, but yesterday's new infection makes me wonder. That kind of goes to what Sheila was saying of, just the birds hanging out longer, it appears this year than normal.
Yeah, we had hoped that maybe we were beyond the worst part of this, and we had early outbreaks in the broiler chickens. And we had, a few weeks ago, we had that in the laying chickens, and not much that was going on here in Nebraska, although across the borders, there have been a lot. We were crossing our fingers, hoping that, if we can just make it out of this, but doesn't look like that now. And if historically speaking, and you saw the graph, we suspect it's probably going to be mid-June, getting into warm summer months before we can say this is over.
Don? Yeah, I might add that we do a newsletter bi-monthly to quarterly, and maybe we should include a red light, yellow light, green light image for producers or backyard flock people about, yes, we've gone from red to yellow, and we will anticipate hopefully getting to green by this time period.
I would say right now we're still in the red light.
We're red right now, no doubt. Yeah, okay.
And Sheila, maybe you can talk a little bit about, do upland game birds, pheasant, quail, grouse, etc., carry the virus?
I'm not as up on that. Dr. Reynolds might know how
Okay.
many of those species have been positive.
They do. There were
Yes.
2 commercial game bird operations that were actually detected and quarantined, one in Texas and one I believe was up in the north central area. It was either Minnesota or South Dakota. Now the one in Texas presented an interesting economic case, because that was the only AI case that was detected in Texas. And all of a sudden Mexico threw up a trade embargo, and they weren't able to get apparently some of the poultry products that they export from Texas over there. My understanding is that it has been worked out now. And maybe you would like to comment, or maybe you don't know.
You're cutting out there at the end, Don.
Sorry. Dr. MacLachlan, do you have any knowledge of that, about the Texas embargo that went in a few weeks ago because of detection in the game bird flock?
I'm sorry. I think I've moved on to a new position. I really looked at the 2004, 2015 outbreaks very closely. I would defer to APHIS and probably my colleagues who are currently looking at that. Plus, I'm limited to what I can speak to what's published. So really can just do retrospective at this point.
So Don, maybe you can just clarify that really any poultry or wild bird is able to carry the virus and get infected with it, regardless of its housing facility.
Yes, that's true. That's true. However, it seems like waterfowl are the most prone, especially those that carry the low path, and those that are not what we might say asymptomatic carriers.
Yeah. Okay, great. Sheila, if you could answer this, what research is being done to treat backyard flocks, or maybe you can talk about the different treatment protocols between what would happen at a commercial operation versus a backyard flock?
Yeah. So basically, commercial operations are closing up birds, trying to make sure that there's screens that keep birds out of the facilities. One interesting research project, it's not available yet, but on fan intakes going into houses, looking at UV light that may kill the virus. Dr. Reynolds has probably seen some of that as well. So there are projects going on, as well as development of vaccines. And usually these are done in commercial operations, and it may take a year or two to pass those on to the backyard flocks. I would really encourage backyard flocks to look at the biosecurity website that we have and learn the terms and how to do this biosecurity program to protect their flocks right now.
Yeah, thank you, Sheila. And if you could put that website in the chat. We'll make sure to distribute to all the participants today.
Yeah.
Dr. Reynolds, you were talking about testing and what happens if there is a test. It's okay to test, and what happens and what's kind of that timing? Let's say if maybe it's commercial broiler or a layer test positive, and how soon after will you, after that testing will you actually get it? I know you talked about when it gets to the lab, it's several hours, but maybe you can just kind of clarify that a little bit.
Let's talk about and I saw this on the in the chat box there in the question. It talked about. Let's just talk about go through the scenario of a commercial broiler. In a commercial broiler operation, they will come out, and fortunately, all birds are contained in one facility, one barn. There may be several barns on a farm. Birds are contained in a building, and usually the method of depopulation is that they use firefighting extinguisher foam, and they have these large apparatus. And again, this is the federal authorities come out and do that, and they basically crowd the birds to one end, and then they cover them with foam. And the foam basically starves them from oxygen, and they die of suffocation. Now you have all these birds. What do you do with all these birds here? I mean, there's tens or hundreds of thousands of them. Typically, they pile them up, or they windrow them up, and they put the litter from the barn on there, and they might have other sources, what we call carbon sources, to add to that, and they will compost those birds right in the facility. So they raise the curtains, they make the facility as tight as they can in terms of airflows, turn off the fans, et cetera, and they heat the building. The heat tends to inactivate virus, and it also promotes the composting process. So they allow that to compost, and I must say, I don't know for how long. I'm assuming that would be for a few weeks. And then that there's more testing done. And I just looked it up on the website when I saw this, and after it's removed and everything is pressure washed and it's disinfected and it's clean, et cetera, then it has to be retested. And here is what the USDA says about downtime, period of time before new birds come in. And it says diagnostic testing may be required depending on the disease agent. The Unified Incident Command will provide guidance on restock testing. So in other words, it's the USDA APHIS people that are controlling this. They will tell you when it's safe.
Yeah, so no real specific rule, just whenever everything tests positive or tests negative or yeah.
I suspect it'd be, I'm sure, at least weeks in a broiler operation. When you have a layer operation, especially these, aviary type cage free, there's birds all over the place, and and they have different levels, et cetera. So there's a lot of places for that virus to hide. So it's probably a more complex, a longer feature.
Yeah, and it looks like one of the attendees also provided some detail. Looks like Bailey said the first round of composting is 14 days, must sit 131 degrees, average of 3 consecutive days, turned and typically moved outside. So we can pass that on to some of the attendees as well. Thanks, Bailey, for providing that. And just the website that Sheila had mentioned that about for backyard flocks detecting is big red biosecurity.unl.edu.
Yeah.
Great. Matt, it looks like we have a question for you, and it's what is the percentage of fresh versus frozen in turkey consumption? Maybe you can provide a little bit about that.
Yeah, so my group primarily focuses on BLS data to look at how prices change over time. They're the best resource for that. However, NASS, or the National Agricultural Statistics Service, also provides information on production indicators. And it looks like at the wholesale level, the chilled versus frozen volumes, it looks like frozen's around 20%. I just looked that up when I saw the question. You can also go to nas.quickstats.gov, and that should be a more comprehensive resource for that as well. Yeah, I hope that answers the question.
Yeah, thank you. Looks like we have time for about one more question. If you have, I'll have just one question for you, just to kind of reemphasize something that Dr. Reynolds said about high path can become zoonotic, which means it can spread from animals to humans, but there really is no concern for, I guess, poultry going through the production system. Maybe you can just comment and just clarify on some of that for us, Dr. Reynolds.
Yeah, in terms of zoonotic potential, it's mostly when people have exposure to the birds, and exposure to the birds' excrements or secretions, et cetera. It's not in the meat, et cetera. Now, what the CDC says is they recommend nothing special about avian influenza.
Hey, Don, looks like you're cutting out there. Sorry about that.
Okay, what part didn't I answer, or can you be a little more specific here?
Yeah, just you were cutting about halfway through.
Well, the influenza is zoonotic, and as I said earlier, it can cause mild respiratory signs. CDC has not declared it as a public health. It is not transmitted through the meat or through things that people consume or through the egg. It can be transmitted on the egg to other birds or facilities, et cetera. That's why the eggs are foreign. Hope that answers the question.
Yeah, great. Thanks for just re-emphasizing that the average consumer who's going to go to the consumer market shouldn't be worried that the poultry meat that they're buying has high path on it. That won't be there. And I think James kind of wrapped this up really nicely of asking, do we think avian influenza will be an annual event, or is it going to cycle every so many years? I think we don't really know on some of that. I think the US is really fortunate when we think about it, that we've actually been able to really prevent avian influenza for a long time. If we look at other parts of other parts of the world, avian influenza is kind of an ongoing incident that they face. And yeah, there's thoughts from our panelists, Matt, Don, Shelia.
Historically, I'm sorry, go ahead, Dr. MacLachlan.
After you, Don.
Historically, it's been every 5, 6, 7 years, something like that. When you have major outbreaks, small ones will pop up all over the world. That's for sure. I think one of the things, I'm going to go off track just a little bit, but I think it's worthwhile here. Our only defense right now for avian influenza is biosecurity. That's the only thing we can do. That and eradication. So we keep the bird from getting it, or if they get it, we go in and we kill them. I think what's going to happen because of this outbreak, there's going to be increased discussions about using vaccination for prevention.
Matt?
That was a fantastic answer. I have nothing to add to that.
Sheila?
I would agree.
Yeah.
Concur. Yes.
Well, thank you to everyone who participated, and in particular to our panelists. I think they provided a lot of great knowledge, and would be more than happy to answer questions after the webinar as things come up. And a recording of this webinar will be posted at cap.unl.edu, where you can also register for other upcoming webinars. And in particular, you can join us next Thursday at noon for a webinar looking back at data and conclusions of last year's TAPS on-farm management competition program, where producers actually compete against each other and make real live management decisions. Dr. Matt Stockton here at the University of Nebraska-Lincoln will share out some of those results. Also, what's going to be coming is a link in the chat box to a brief survey. We really appreciate the feedback. It's from feedback like this that we can plan other webinars and also get information on what we can do to better serve constituents. So thanks again for joining us, and hope to see you back here soon.
Thank you, Elliot. This was a great opportunity to kind of clear the air and give people where we're at now.
Yeah.
Update. Very nice.
Thanks for joining us, Sheila. Thanks, Don.
Bye.
Thank you, Matt.
Thank
Yeah.
you.
Elliot, if you could send me a link, or maybe it's on here where people can access this webinar, I'll put it on our Facebook page.
Yep, I can definitely do that.
If you could either mail that to me, okay?
Yeah.
Thank you.
Thank you. Yeah.
All right, bye.